Artificial Intelligence in Nursing, presented by the New Jersey State Nurses Association and the Institute for Nursing. Planners, content experts, and speakers on this presentation have declared no conflict of interest. There is no commercial support for this activity. At the conclusion of this microeducation, 100% of participants will successfully report understanding the meaning. What is artificial intelligence, or AI? Well, the term artificial intelligence was coined by a Stanford University professor named John McCarthy in actually 1955. Artificial intelligence was defined by Professor McCarthy as the science and engineering of making intelligent machines. According to IBM, one of the founders in the computer industry, artificial intelligence is technology that enables computers and machines to simulate human learning, comprehension, problem-solving, decision-making, creativity, and autonomy. Advances in artificial intelligence create computers which have the ability to do amazing things, such as understand human language and respond appropriately. These computers can learn from new data provided to them and make informed decisions, plan interventions, or even make recommendations based on their understanding of the information. One example of an independent thinking machine capable of taking the place of the need for human intelligence are the self-driving cars we've all heard about in the news. Other uses of AI include machines for roles which previously required a human being. IBM reports groundbreaking research which includes AI technology that can create original text, images, video, and other content. It is important to understand the two concepts on which artificial intelligence is built. Those two concepts are machine learning and a subset of machine learning known as deep learning. Machine learning creates models that analyzes data to find insights in an unbiased manner. There are many different types of learning techniques or algorithms, which are dependent upon what type of data is being analyzed, issues or problems needing to be resolved, or what type of questions that are in need of answering. The goal is to design an intelligent machine by exposing it to data, thousands and thousands of pieces of data, and having it use algorithms to analyze that data and draw conclusions and allow it to learn from the exposure. According to Microsoft, they refer to these algorithms as a recipe for computers. Here is a list of just the few most common types of algorithms used: neural networks, linear regression, logistic regression, clustering, decision trees, and random forest. Deep learning is a subset of machine learning. According to IBM, this is accomplished through a series of multi-layered deep neural networks that are very similar to those of the human brain. It operates in a similar fashion. This neural network allows a significant automated data extraction that does not require human interaction. IBM further explains that through a sophisticated network of node layers, including the input layers, multi-hidden layers, and the output layers, knowledge is actually gained by the machine, which enables that machine to use that new data to create improved models of learning in the future. This technology is very similar to some of the science fiction movies some of us are familiar with from the 80s and 90s. Have you ever had the experience of having a conversation around your phone and then suddenly you're surfing on social media and perhaps the island that you were just talking about possibly vacationing to, you now have sales and advertisements for that country destination? Or ever notice advertisements on your social media feed for things that you just did a search for on the internet, maybe through a search engine? AI has the ability to data collect by listening, predicting, producing, and communicating, and is being used widely in marketing. AI is being used in our everyday lives. It's being used in our homes. If you use a voice-activated assistant, you're using AI. I know a lot of families that won't even consider having some of these products in their homes. But anytime you call out to your smartphone to ask her what the time or the weather is, you're using AI. Have you ever called out to a device in your home to recommend restaurants, order more items through your online account, or just to say, hey, set a timer while you're using AI? Do you use one of those vacuums that automatically cleans your home, bumps into things, turns around, and cleans up some more dog hair? Well, those vacuums are learning your home's layout, and it's making life easier for you. That's AI. These are all examples of AI in the everyday environment. AI-based support systems offer a potential resource for reducing the cost of healthcare, increasing the efficiency of said services, and creating a highly valued support system for the well-being of patients and the healthcare sector in general by contributing to the satisfaction and clinical safety of patients and their families. AI is currently being used in diagnostic software, improving the diagnosing process, improving patient care, and subsequently having better outcomes. Here are some examples of how we're currently using AI in nursing. Real-time dermatological biopsy results to improve treatment times. Advanced diagnosing abilities in cardiac amyloidosis. Early warning signs for sepsis risk. Diabetic foot ulcer management. Post-operative follow-up phone interventions, and assisting in monitoring homebound or shut-in patients for signs of disease progression or social isolation, depression, and anxiety. Additional ways we're using AI in nursing are AI-powered nursing education simulators, which are credited with improving clinical decision-making for students. Method of monitoring patients from a distance. Workflow optimization, including rehabilitation and respiratory exercises, evaluation of the elderly, and accompaniment of people with dementia and behavioral therapies. We've seen these robots being used in the hospital settings already. Additionally, AI is being used for continuous medical device monitoring. There are some growing concerns, however, that AI will negatively impact the care delivery system of nursing by replacing tasks once performed by humans, as well as ethical concerns to the AI care. One of the examples stated was that the use of AI for physicians in prescribing medications to patients with new medical conditions would be safer, faster, and streamline the process. But then that raises the question, what happens when errors inevitably occur using AI? Who is accountable for these errors? Advancements in technology can certainly improve decision-making, but may also diminish patient-centered care. There is also such a thing as an over-dependency on technology. Facilities will need to be prepared with backup protocols in place, especially as the AI becomes more sophisticated with helping us on our day-to-day job. It could also be a little bit paralyzing. We have all been in the circumstances where we've worked in a facility where we've walked in perhaps to the change of shift to find out that we have downtime. The computer systems are down and we're doing everything manually on paper, then being left with a daunting task to then transpose everything from paper back into the computer system. There's been a lot of situations in the news lately where there's been different things that were intentionally released into computer systems and that just crippled and paralyzed all sorts of business and healthcare industries. So that's something to think about as well as we get more into the AI in healthcare. This is certainly the first of many discussions on AI and nursing. I thank you for taking the time to listen to this microeducation. Please feel free to leave your thoughts or any observations, comments, your experiences with AI on the YouTube channel link below, where it has a section for the comments, and you can interact with your colleagues and other members of the nursing community. Thank you.